You're listening to the JONKER Talk podcast. This podcast is brought to you by MC242 IPR MSA UITM Malacca chapter as an assignment for PRO549. Remember, Jonker Walk is a place, Jonker Talk is us.
Hello and welcome to our JONKER Talk podcast series where we delve deep into the Millennium Development Goals, a set of 8 international development targets established following the Millennium Summit of the United Nations in 2000. Today, we focus on goal number 6, combating HIV, AIDS, malaria and other diseases. I'm your host, Aiman Daniel, and in this episode, we'll specifically discuss about MDG 6 that aim to halt HIV/AIDS crisis, its global impact, and the ongoing fight against it in Malaysia. I believe many of our listeners today wondered what actually is Millennium Development Goals number 6. So, without wasting any time, let's start by understanding the significance of MDG 6 that been initiated by United Nations in past decades and its relevance in today's world. As already pointed, MDG 6 aim to halt and reverse the spread of HIV/AIDS by 2015, ensuring universal access to treatment for those affected. While significant progress has been made, HIV/AIDS remains a major public health concern globally, and Malaysia are not excluded in this scenario. But first, let's break down the virus itself. HIV, or human immunodeficiency virus, attacks the body immune system, weakening its ability to fight infections and illnesses. Over the time, untreated HIV can lead to its acquired immunodeficiency syndrome, a life-threatening condition. To provide a deeper understanding of the virus and its impact, we are joined by Mr. Ahmad Luqman, a member of IPRMSA UITM Malacca Student Club and also an active volunteer member in Malaysia AIDS Foundation. Thank you, Luqman, for willing to join our podcast today. So, Luqman, how long you been joined in this NGO and why you willing to be a volunteer member for Malaysia AIDS Foundation?
Well, Aiman, first of all, thank you, Aiman and Jonker Talk, for inviting me in this podcast interview. It is an honor for me to be here. Well, I mean, it was 4 years ago since I signed up to be an active volunteer member for Malaysia AIDS Foundation.
Oh, I see.
And at that time, I felt that it's part of my social responsibility to spread more awareness about AIDS and diminish fear-monger and hatred among societies towards AIDS patient communities. And I was stumbled upon on a tweet that I read years ago about how an AIDS diagnosed patient lived a miserable life after being discriminated by its own family members and friends.
Oh, what a poor chap.
Since then, I decided to put this hatred on end and encourage more people to be more supportive towards any AIDS diagnosed patients, regardless of their background and lifestyle. And throughout the years, I've been actively participating in a lot of charity events that organized by Malaysia AIDS Foundation, such as fundraising marathon and also awareness campaign in some of the local universities here in Malaysia.
Wow, that's such a wonderful spirit.
It's nothing.
But I believe your pure intentions would inspire a lot of our listeners today. I personally do really applaud your efforts. So,
Thank you.
without further ado, let's jump into our discussion. Luqman, can you elaborate more on the different ways HIV can be transmitted and the importance of early diagnosis?
Absolutely, Aiman. So HIV can be transmitted through unprotected sexual contact, sharing contaminated needles or syringes, and from mother to child during pregnancy and also childbirth and breastfeeding. An early diagnosis is crucial because it allows for prompt treatment initiation, which significantly improves the quality and the lifespan of people living with HIV. So, however, many people saw HIV or AIDS only were caused by The negative lifestyles such as same-gender sexual intercourse
Mm-hmm.
that considered as taboo in our societies. So, as a responsible human being, we cannot judge people upon their lifestyle and sexual desire that's strictly confidential and privacy to its own.
Yes, I totally agree with that, Lokman. So,
Mm.
Lokman, does HIV/AIDS can be treated and that person completely free from the disease?
Well, Aiman, sadly, although we live in a full advanced technology,
Mm-hmm.
till this day, there's no any solution that could cure AIDS disease from a person 100%.
Oh.
However, an AIDS patient need to undergo some of the follow-up treatments such as antiretroviral therapy, also
Mm-hmm.
known as art therapy. So this therapy involves taking a combination of medications daily to suppress the virus,
Mm-hmm.
allowing people with HIV to live long and healthy lives.
Mm-hmm.
So when the virus is suppressed to undetectable levels in the blood, it is also untransmittable to others through sexual contact.
Oh, now I know some
Yeah.
of the how HIV AIDS can be transmitted. But thank you, Lokman, for wonderful insights. Now let's move
You're
on to the
welcome.
next segment, which is global impact of HIV and AIDS. Now, our listener, let's consider the scale of this deadly epidemic. According to the World Health Organization, an estimated 38 million people were living with HIV/AIDS globally in 2019. In Malaysia alone, according to Ministry of Health in 2021, there were estimated 81,942 people live with HIV in Malaysia. 83% of them whom were aware of the status and had been notified through the special designed national surveillance system. Despite advancements in treatment and prevention, stigma surrounding the disease remains a significant barrier. Let's explore this concept of stigma and its impact. To our dearest listener, stigma refers to negative attitudes and beliefs associated with a disease or condition. As it was pointed out by Lokman just now, there's a lot of AIDS patients being untreated fairly and judgmental by societies. Bad stigma can lead to discrimination, isolation, and fear, preventing people from seeking testing and treatment. Lokman, in
Yes.
your humble opinion, as
Mm-hmm.
you were actively participating in volunteership that
Mm-hmm.
highlights AIDS awareness, how you would tell to our listener today to scrap off bad perception towards AIDS diagnosed patients?
Well, I mean, basically, perception is everything.
Mm, yes, correct.
And changing people narratives and perception towards other people isn't a simple job. However, some measures can be taken to increase our own self-awareness towards AIDS disease. For instance, a good education.
Mhm.
As we all know, a good education begins at home, man.
Yes.
And it's about time that parents out there to speak more about things that were considered as taboo to their kids, especially sex education
Mhm.
and its consequences that can lead to AIDS if abhorred. So every souls need to have empathy and compassion towards those less fortunate that have been diagnosed with AIDS. And sharing personal stories of those affected by AIDS can humanize the issue and foster understanding compassion among us.
Yes.
And we as a part of societies
Mhm.
need to urge the government to provide more support services for people living with AIDS, and including counseling, healthcare, and social services, because these services can help improve their quality of life and reduce isolation so that they can feel belong more among societies.
Yes, I completely agree because I saw a lot of AIDS patients being discriminated and untreated fairly from our society, and
Yeah,
this is really sad to see that as a
it is
Malaysian.
it is already being normalized here,
Yes, I will totally agree with
especially
you.
in Islamic countries.
Yes. So, thank you for your wonderful sharing and advice towards our listener today. I believe our listener today gained a lot of benefits from your meaningful insights, Loman.
You're welcome.
That's the end of sharing session by Mr. Ahmad Loman. But this podcast still not over yet, as I will share more about MDG6 next. Now, moving on to the next segment, which is overview towards Malaysia's effort in combating HIV/AIDS. So, to our listeners, now let's focus on Malaysia as an example of a country actively confronting HIV/AIDS. In Malaysia, the epidemic primarily affects specific populations, such as injecting drug users, sex workers, and men who have sex with men. The government has implemented various strategies to address this, including harm reduction programs. These programs provide clean needles and syringes, preventing the spread of HIV through needle sharing among injecting drug users. Awareness campaigns, such as educational campaigns, raise public awareness about HIV transmission, prevention, and the availability of treatment options. Antiretroviral therapy programs are also known as ART programs. As was mentioned by Mr. Lokman just now, the government through Ministry of Health subsidized the therapy to allow less fortunate patients to receive a fair treatment like everyone else. These programs make life-saving medication accessible to people living with HIV, allowing them to manage the virus and live healthy lives. But since 2001, Malaysia has also achieved notable milestones in its fight against HIV/AIDS. One such achievement is the Kuala Lumpur Declaration on AIDS in Asia and the Pacific, adopted in 2001, which was traced back like 22 years ago. This declaration emphasized the importance of a comprehensive approach to HIV prevention, treatment, care, and support, setting a powerful precedent for the region, especially in ASEAN region. Another key player is the Malaysian AIDS Council, or also known as MAC. Established in 1992, MAC advocates for the rights of people living with HIV/AIDS, provides crucial support services, and spearheads nationwide awareness and prevention initiatives. Now, let's moving on to the case study, which is HIV spread among sex workers. Sex workers are a key population at high risk for HIV and sexually transmitted infections, or also known as STI. Sex work, the exchange of sex for money, goods, housing, or other services, presents health hazards to those who work in the industry, including a heightened risk of disease exposure, both from sexual and drug use related risk behaviors. In Malaysia, although Malaysia bans any sex work, 70% of HIV recorded in Malaysia were contributed by heterosexual sex that mainly committed by sex workers that roam around the nation secretly. According to the ex-Minister of Health, Dato S. Subramaniam, most of the cases involve men who contract HIV or AIDS after having unprotected sex with female sex workers. These men, after being infected, then pass on the disease to their family. He quote, he also said there are currently 40,000 female sex workers at risk of contracting the disease. However, HIV prevention efforts among sex workers in Malaysia are complicated by laws prohibiting sex work, resulting in a largely hidden population. A lot of sex workers remain vigilante and avoid to do the test in any health institutions due to fear that they may caught for their illegal activities by the authorities. Therefore, all parties need to come up solution that could boost HIV testing among sex workers without instill fears towards them. Some effective strategies can be applied, such as ensuring confidentiality and privacy in HIV testing services, or increased accessibility to HIV testing, and engaging sex workers themselves in the design and implementation of HIV testing programs. Despite progress, challenges remain. Inadequate funding restricts access to treatment and prevention services in some regions, especially in rural areas. Persistent stigma and discrimination continue to prevent people from seeking help. Additionally, the COVID-19 pandemic has disrupted access to HIV services in some areas. It's crucial to address these challenges simultaneously. Looking ahead, it's vital to maintain momentum. Continued commitment from governments, international organizations, and civil society is essential to sustain progress and accelerate efforts to combat HIV/AIDS. Enhance education and awareness. Comprehensive sex education and awareness campaigns can dispel myths, reduce stigma, and promote preventive measures. Expand access to testing and treatment. Scaling up testing and treatment services, particularly among key populations, is crucial to reaching those most in need and preventing new infections. And lastly, strengthen our healthcare systems. Investing in healthcare infrastructure and training healthcare workers, especially in rural areas, can improve the quality and accessibility of HIV/AIDS services. In conclusion, MDG 6 focus on combating HIV/AIDS, malaria, and other diseases remains a critical global priority. While significant progress has been made, challenges persist, requiring continued commitment and collaboration from all sectors of society. By working together, we can achieve the goal of ending the HIV/AIDS epidemic and ensuring a healthier future for all. Thank you for tuning in to this episode of Jonker Talk. Stay tuned for more insightful discussions on pressing global issues. Goodbye for now. I'm Daniel signing out.